Thank you very much. So what we learned is, and good morning, everyone. What we learned is that the Catholic Church has harder and more stricter GDPR regulations than the government and regulatory. What we learned is that ecosystems and healthcare are the basis actually for providing and delivering a patient outcome and patient care across all touch points and along the entire pathways, which also explains the complexity. And what we also learned is that self-organized teams enabled through technologies are a clue to operational excellence. I will talk a little bit about operational excellence with you today. And I actually have a lot of notes here that I will not use. So who are we? I think we are the new kid on the block. Most of you will not know Futurice, as we have been found around 22 years ago in Helsinki, originating from the Nokia ecosystem, very early stage software development, increasing in numbers, increasing in the way how we operate in different domains and industries. We are a number of some 750 plus people from data, from tech, from design, from strategy and business. We like to develop systems, products and services that are future thinking and future forward heading. And we like to share what we do. As you can see, we're operating in different countries across Europe, or Northern Europe, specifically in the Nordics, Germany and London. And we do have different hubs that we are currently building in other regions of the world. What we always encounter is the quest for digital readiness or digital maturity. And I think this is one of the big challenges and questions that need to be asked if we want to go into the question of what is exactly meant by operational excellence. And if we look at numbers, and let me derive a little bit from numbers that are not specifically healthcare, but they are somehow symptoms. They're providing indications of what we can see is during the pandemic, and we've been hearing what has been happening in the hospital context triggered through the pandemic. During the pandemic, we could see that investments in Germany have actually been increasing from 55% to 71% in terms of digitization investments. And we've been seeing a couple of numbers earlier that showcase that there's a huge potential in the market for digital services in healthcare in terms of reducing costs for different organizations. But what we are seeing, and this is something that should somehow make us a little bit astonished, is that from 2021 to 2020 to 2021, numbers are decreasing again. So it seems like something is happening in the market that is very unclear where we are. At the same time, what we also see is that digitization strategies are finding access into organizations. We can see a large number of organizations that do have central, it's 30% around central digitization strategies. This is the basis actually that needs to be implemented, a digital strategy and data strategy, in order to come up with any kind of applications later on that lead you to become data enabled as an organization. So when some 10 years ago, smart home was actually the rock star of the markets, and any kind of smart home applications, IoT enabled devices were thought to be the big thing in the market, and only sky was the limit. We found that this was not true. So a lot of numbers that we could see from back then, where the huge market potential was mentioned and needed to be exploited, we didn't reach that goal. And one of the reasons why we didn't reach that is definitely we didn't have the use cases that supported real applications that made sense and are relevant to human beings and people and users. We didn't find the way how to actually implement that in the daily lives of people. Similar things are definitely can be seen, and there are references that we can draw from what we could see here in the smart home application field to what we can find in healthcare when it comes to operational excellence. So many of those aspects are not only looking into the questions of how to actually continuously improve patient care in the healthcare environment, but if we look at operational excellence, we may not misunderstand it as operational efficiency only. or increase of financial value. Operational excellence involves the human being from A to Z. It's the very important thing that needs to be taken into consideration. And if we look at and how this all comes together, and I will take you on this guided tour through a couple of examples where we actually build applications that are referring to what we consider operational excellence. If we look at that, I would like to show you a couple of aspects that are important for organizations once they develop. So there are three paradigms of organizations. If we look at where organizations are today, where they have been in the past, we can see the classic organizations, which is mainly managing large numbers of people. Classic organizational setup. We can see the innovation organization, which is harnessing on the brain potential of the individuals. It's looking into bringing people together and having them collaborate in a strong and creative way. And what we can see where we are heading to today is data and AI-driven organizations, enabled organizations through data and AI that bring way more than just the human being with its competence and skills to each other, but also using data and technologies in order to make sense out of it. So as single entities, organizations, when they're small, in the process of growing, what happens is that silos are created. And what we can see is that in growing organizations, disconnections are causing a huge problem and constraint in knowledge sharing, in collaboration, in developing horizontal layers that are so important, especially if we look at healthcare, where the question of how to distribute services and products to patients along the entire pathway often have to run through vertical owners and ownerships of certain phases. That these kind of disconnections are very often limits to organizational growth. Now, if we look at numbers, and if we take a look at, as an example only, of what has been indicated in 2020 in terms of errors, I just want to pick one number, which is measures that are undertaken too late. So the question of how to mitigate the risk of knowing too late what is actually happening in healthcare, understanding how to treat in the most potential and best way early enough, by indicating early enough what is happening, is a huge challenge. We as Futurice have been through this growth of the organization where if you're very small, you can easily talk one-on-one, but if you're getting bigger, it becomes a little bit more difficult. We have been tackling a similar problem. Growing from a small entity to more than 700 people, obviously it's not a Fresenius and it's not a St. Augustin Kliniken size of more than 5,000 people or whatsoever, but nevertheless the systematics are the same, or the mechanisms are the same. We develop tools like the bubble burster that are knowledge sharing and knowledge management tools. This tool, for example, connects topics to people. And that creates value for the organization. And that value for the organization is so important because at the end of the day, what we need to do, and this is what everyone here in the room, I guess, has to do within their professional business context, is we have to take care of the customer experience or the patient experience. We have to look at what is actually needed and what is needed in a relevant way derived from insights. We have to look at operational excellence, operational processes. How can we become faster? How can we become more secure? How can we become more efficient in what we do? But we also have to look at new business models, obviously. So what is the future looking like when generating benefits and revenues from what kind of business models? And ecosystem thinking definitely plays a fundamental role in the question of trust building and sharing and understanding that 1 + 1 is not 2, but 3, and ecosystem thinking is highly important. And at the end of the day, we have to look at connected company, which means how can we close the disconnects within organizations? And that's a continuous process that everyone has to undergo. And that can be fueled and empowered by the footprint of data that we gather along the way and make sense out of it. What you don't want to do is you don't want you don't want to keep the status quo. And you don't want to fix something that only when it's broken. You actually want to fix the ship and build the pool at the same time. And that means a continuous process that doesn't stop, and that puts you into the position to create resilience within your organization that eventually builds operational excellence. Now, going back to the health environment, if we look into topics like safety and quality, obviously, that is in a hospital context something that is fundamental. Any kind of non-safety or diminishing of quality might lead to fundamental and existential problems of the organization, but also of patient. So if we look at what's happening in terms of situational awareness, how can we make sure and provide you and enable organizations that they actually become capable of measuring and using existing data, analyzing, sorting, and making sense out of it in order to become able to predict what will actually happen in the future. As I told you about the bubble burster, where we connect topics with people and enable our own people to understand the organization better and to connect within the organization, we, in a very evolutionary process, developed that further and came up with a tool that we call Futucortex. And within Futucortex, we connect topics with everything. So it's not just topics with people, where one can understand who has been working on a certain topic in the past in order to share knowledge. But here it's actually a wider system where we try to connect everything. This leads us to sharing knowledge in a way that provides us with becoming more predictable in terms of our own business. And to give you an example on how that actually affects the healthcare environment, where we all know that employee experience is highly important, where we know that employee churn is a problem, where we know that employee retention, just like in any other industry domains, most probably is a huge challenge for the organizations. What you see here, and I would like to just point out two little factors. What you see here is data that we collected, and I think this is interesting for you because your tool is let's say an internal tool, a communication tool, an exchange tool, a messenger that we also use within Futurice. We collected open data from communications within the organization and from public data that we have within the organization. You can see a number of around 20 to 30 employees of the organization that at one point left the organization. So we are very good in people business. So what we do is we do exit interviews in that very moment where someone leaves the organization. But exit interviews is not enough. We don't have historic data. The idea of understanding better when does it happen and what are the indicators that show us that someone will leave the organization is a huge asset to us, because there's nothing more valuable than the human within an organization. We look at different points. We look at purpose. We look at happiness. We look at the way how someone is satisfied with the colleagues. We look at everything that is so important that we can derive from the sources that we have. And everything that is red is this is the moment where people decide to leave the organization. Now, the interesting point is that at the very beginning, 52 weeks, 1 year, looking backwards, you can see a lot of green. People are very happy. They're content. They feel that this is actually the purpose is met, their purpose is met. The more you come down to the point where actually people leave the organization, it becomes red. But what you see here, and I would like to pin this out, is there's around 5 months prior to leaving and departing the organization, it's very green. So there's no stress. People feel content. And the interesting point here is that this is the moment where a decision has been taken by the individual. So the stress, they are relieved from stress. They know that they took a decision for themselves, and from there they can take it on. Now, knowing this, question is, how can we as an organization interact in order to create more operational excellence for us while knowing what is happening here? Same is important when we look at leadership. Very often in organizations, leadership is pretty much disconnected from the frontline business and from the experiences that are happening out there. We do similar things. We also take measurements of where does knowledge actually happen and how are teams connected and how are topics connected. And what we can see there is that we can enable and empower leadership by using this kind of data to take more right decisions, to take more data-driven and data-enabled decisions that are actually looking at the organization as a whole. Would like to give another example on how the efficiency of healthcare system performance is in a ranking that was done in I think last year, and I would just like to pin out the US numbers here compared to the Norway numbers. Now there were 5 indicators that were actually mentioned in that ranking. And those 5 indicators were actually access to care, process, administrative efficiency, equity. So what we could see is that in terms of administrative efficiency, the US was ranking last place compared to Norway. Now there's indications that show that the multi-payer system that the US is operating in might be a reason why paperless administrative processes are so much more of a burden than we can find it in Norway. It's just a guess. And the question is, how could we overcome, or how could organizations or systems overcome these kind of problems? So our approach to these complex situations is actually looking at agile in transforming organizations and systems. Now, there are certain problems and, let's say, constraints that we can find if we look at Agile, which on the one hand is the question of visibility, the question of reason that we can find, the concrete use cases that need to be defined, that are very often not existing, and certain solutions obviously need to be deployed in organizations in order to become Agile. Now, very many organizations do apply Agile practices already, very often smaller teams. But the question of how to actually scale it to the entire organization is the big challenge, because we very much know, and especially in healthcare, we are fighting against a strong legacy. We are looking at systems that are highly regulated, and we are looking into very hierarchical systems. And you've been mentioning that nurses have been for the first time speaking with doctors in a very direct, or with the director of a hospital in a very open way. We've been seeing that in research that we did over the past years very often, that there are still constraints in terms of communication and hierarchies.
Sven, sorry for interrupting, like 2 minutes.
Yes. So all of that is important by taking into consideration, on the one hand, strategy, but at the same time, the culture of an organization. So anything that is business related here and everything that is people related on the other side. And while looking at how leaders actually look into decision making based on data, we can see that numbers are indicating that on the one hand, everyone sees that data is a business concern, but very often data is not used because it's very difficult to decode and to implement. So I would like to close with the fact that it's not the technologies that are the constraints. It's usually the human beings. We have the data, but it's the capabilities and skills that need to be developed within organizations in order to create something like operational excellence. And at the end of the day, you need to consider, on the one hand, your business goals and your strategic goals, but at the same time, the cultural change that needs to be implemented within the organization. Thank you very much.
Thank you.